Is Morning Cafe. I'm yours truly, Stanley Ringita. For Matters Eye Care, right now they want to focus on your skin because it is a very important part of your body from head to toe. Yes, we talk about enzyme therapy treatment. Now Shiksha Arora will be handling this. Over to you, Shiksha, just telling us and speaking to an expert on enzyme therapy.
Welcome back to the Morning Cafe. I am Shiksha Arora, and as you can see, I'm currently at Skin Reveal Aesthetics, where we're going to be talking about all things beauty and skincare. Of course, skincare is a very important part of our lives. There's a lot that happens behind the scenes under our skin. So to get to know the specifics and an insight on how to manage your skin, I will be speaking to esthetician Milka Wamboi, who is the skin expert, and she'll be giving us more details on what exactly a skin analysis is and how important it is for your skin. So let's get right to it. So whenever you come to a skin clinic, there's one thing that's very important that needs to be done. It's one of the first things that an esthetician will look at, and that is skin cleansing. And that's exactly what we're going to be doing today. Of course, we're going to be also looking at what the skin looked like and what it looks like now. So the skin analysis has already been done, but we'll also be taking a look at the progress. So that's something that esthetician Milka will be giving us more details about as we get into this episode, where we'll be talking all things skin analysis. Hello.
Hi, how are you?
Good, how are you?
Fine, thank you. Thank you for visiting.
Thank you so much for having me. And
yes.
Yeah, maybe you can take us through what skin cleansing really is and what the importance is.
So, as a standard procedure at Skin Reveal, anytime a client comes for skin analysis, it's important to cleanse. Why you want to cleanse is because the skin accumulates dirt, oil, debris, and of course the skincare the client has. So for you to get accurate results, it's important for you to remove what is there so that you can have accuracy as you're having the skin analysis. So the first thing we are going to do for Marlene is cleansing. She's been client with us on a treatment journey. So today we want to see whether we've been getting any progress. So our skin analysis entails two treatments. The first one is the starting of the journey. Let's see where you're at. We educate you. We see what's the best treatment, what's the best home care regime. And the second analysis is to see, are we progressing? Yes, so she came around March. She was been struggling with acne, and we started on a treatment program that was customized to her. We also educated her on what she needs to change. We had been
her lifestyle.
Yes, there was some things she was doing, like sugar and honey scrub DIY, which was causing more inflammation rather than treating the skin. So we educated her, this is not right, this is what you're supposed to do. In terms of diet and lifestyle, it entails how do you sleep, what do you eat, what are you exposed to every day, and what are you using on your skin. Skincare is very important, so we'll get started.
All right, excited to see what it looks like, because I feel like so many of us do the basic things wrong when it comes to cleansing your skin.
Yes.
You know, there's different steps that you need to do, and I feel like most of the time, because of how busy life is, you miss out on some of the most important things.
Yes.
Maybe we can also get some tips on how to
definitely
do it right.
Yes. All right, so let's get started.
So what exactly is that? That's a cleanser, I'm guessing?
That's a cleanser. We're using a cleansing milk.
Okay.
Reason is we don't want to really use something that's a bit harsh. You want
something that's very mild.
Something that's mild, suitable for all skin types, skin conditions.
Yeah, it says sensitive skin.
Yes. Because it's the first interaction with the client's skin. You don't want to assume they will use a cleansing gel, cleansing foam. So start with milk.
And cleansing milk is milder than the foam and the gel?
Yes. We have cleansing creams, cleansing gels, cleansing foams for different skin types. So we use a white cloth.
Lukewarm water or cold water?
Lukewarm.
Yeah.
Are you feeling sensitivity? Okay. So as we rub it onto the skin, it will feel like it's not cleansing because it feels like milk.
Yeah, like a lotion.
Yes, yes. But ideally, it's doing the work. Yeah.
And how many times are you supposed to cleanse your face in a day?
Twice a day.
Okay.
There's always debate that in the morning you don't need to cleanse.
Yeah,
because
I've
you've
seen
slept.
some articles
Yes.
saying a bit of that because once you do your nighttime routine,
Yeah.
you don't need to do much in the morning. Is that true?
I would say it depends with your skin. If you're struggling with, ideally when you sleep, you also have dead skin accumulation, there's sweating at night. I think it's important to cleanse in the morning.
Yeah.
Not unless you've had a specialized treatment and you've been guided. Don't cleanse in the morning because there's sensitivity. Maybe there's sunburn, so the skin becomes a bit sensitive. But ideally, you're supposed to cleanse in the morning and in the evening.
Okay.
So during our cleansing, we also try to understand, do you cleanse your skin and how do you cleanse? We always tell the client around the eye area is important. Those are hidden spots. Of course, in the shower, we'll tell you to go behind the ears. Yeah. Around the hairline. Yeah. People struggle a lot with acne around the hairline. Circular motions.
Always circular motions.
Yes.
Sometimes you just see people washing like this.
Yes, yes. That is
Up and down.
That is going to increase sensitivity. Don't be very harsh because the cleanser is removing the dirt, the oil. You just need to rub gently.
It's always round.
Yes. Around the sensitive areas. You use your ring finger because it's the weakest in terms of pressure onto the skin.
Learn something new today.
Yeah.
So like this.
Yes, using the ring finger.
Wow. I was using my pinky.
Yeah.
I forgot what my ring finger looks like. Okay, so basically this one.
Yes.
So you do it like that.
Yes.
Wow. And then wash it off.
Yes. Gently. So there are instances we'll find our cloth still very like black.
Yeah.
We'll do another cleanse and we'll tell you, or we ask you, do you cleanse your skin? Because when you don't cleanse your skin the right way, it means you are not removing so that skincare can go, like it can penetrate better.
It's like dirt that's accumulated. in
Yes,
pores.
so it's a barrier that's stopping the
Yeah.
skincare from settling into the skin.
Noted.
Hairline is also something else. Can see? So
Yeah.
you show the client, you tell the client, this is something I need you to improve.
Okay.
Of course, young ladies want to put edge control oils onto the hairline, but it's important to remove it gently in the evening.
But at most you should cleanse your face just twice, right?
Yes,
Not more than that.
not more than that, so that you don't increase sensitivity.
And also I feel like then you strip off all the oil
Yes.
that is already on your skin, which is good for you.
Yes, the oil is very important. So every time you overstrip that oil,
Yeah.
it has to compensate itself by overproducing. It means you'll feel more oily and you'll get more oilier. So you won't be giving any solution.
And then if you have dry skin, then the skin will get even more dry.
Yes.
Okay.
That will affect something we'll call the skin barrier,
Yeah.
which is the balance of sebum and sweat, which makes up something we call acid mantle.
Okay.
The skin is supposed to be slightly acidic to prevent
Yeah.
bacteria from getting into the skin. You want to keep the good stuff in and the bad stuff out.
Right.
Yeah. So we've cleansed her skin. She's been having chemical peels and she's been using some home care products with something we call tyrosinase inhibitors.
Okay.
Because right now we are tackling pigmentation. It basically just suppresses the melanin not to get overproduced because of her phototype. She's phototype 6.
Okay. What is that?
You are phototype 233. I am
That's the color of your skin.
Yes, I'm phototype
Oh,
4.
Okay.
So the darker you are, the more melanin you produce.
Right.
So it means for more darker skin tones, you have to give something we call melanin inhibitors to inhibit the overproduction of melanin. Yes?
Okay.
Melanin is good to protect
Yeah.
your skin, but anytime she gets any inflammation, it gets overproduced to protect her skin. Yes.
Wow, okay.
Yeah. So we want to try and control it.
Is that what melasma is?
That's a type of pigmentation. Yes, that's melasma. When the skin is
hyperpigmentation.
yes,
There's hyper and this
hypo.
hypo.
Yes, hypo is not any production of melanin,
Right.
and hyperpigmentation is overproduction of melanin. Yeah. So her skin is cleansed.
Yeah.
Ideally, we need to give her about 10 minutes for the sensitivity to settle down.
Okay.
Because we wrapped the skin. As we do that, we can check how her skin has been because it's a second visit.
Yes.
And we can look at her
progress.
lifestyle. Yes, the progress.
How many months since March you said?
Since March.
So like she's been doing this for like 6 months.
It's about from March to now. Is it 6 months?
5 months? Yeah.
Yeah,
Wait,
5.
let's count. 5.
Yeah.
6 months.
Yeah, 5 months. Consistency with it. There's a month we skipped
Okay.
some treatments. Yeah.
That's fine. So
Yeah.
you can say 5 to 6.
Yes, but she's been diligent with home care regimen. Is that so, Marlene?
Yeah.
Yes. Okay.
All right. So we're going to go to that side.
Yes.
And
Yeah. Close your eyes. So I'm taking pictures now.
okay.
We're taking 3 angles. Each angle will have 3 flashes.
Right.
So she's gonna relax her face. Right. Just lower you a bit. Yeah. All right. Starting. So that's front. We're going left.
Interesting. How to get the
We make sure it's
side
matching.
profile.
Yes.
Okay.
I'm starting to make sure everything is opaque. Is this okay?
Yeah. So that's to get the side profile.
Yeah, so the right side. I don't want this white, so I'm putting my cloth here for an opaque.
Okay.
And you're done.
And that's all?
Yes, so
So now it's going to compare the
Mhm.
before and after.
yes, it is going to do that. So
Okay. And it'll tell us like the improvement.
yes, the
Oh.
elements that are going up, the elements that are going down.
Okay.
That way we can make better decisions on her treatment.
And how often do you have to do the skin analysis of before and after, between the two?
We give it 6 months,
Okay.
for some clients up to 1 year.
Oh, okay.
Because if your condition was very problematic, it means you'll have to take more time to have the treatments done. And skin of color is not something easy to treat.
Yeah.
Yeah. Because of the fact that you have more melanin, it means you have to take extra caution not to cause more inflammation. So I can explain the elements.
Yes.
So this is a mask.
Okay.
The mask has,
And I'm guessing these are the problematic areas?
yes.
Okay.
When I remove the mask, it's still showing the areas have more pigmentation or they have
Yes.
spots.
Okay.
And these spots occurred when she got acne. So it's called post-inflammatory hyperpigmentation.
Right.
That is what she struggled with. She gets acne, the acne gets inflamed, it leaves spots,
Yeah.
which is PIH. So ideally, the first thing we had to do was to manage the acne
Okay.
from forming, which causes inflammation afterwards. Yeah.
So the skin analysis, as you said, there's different elements,
Yes.
which are like
Spots, wrinkles, texture, pores.
Okay. And that's
So-
exactly what we're seeing here.
Yes. So this is pots.
Right.
We still have a long way to go. Anything you see below 50% means there's still a long way to go.
Okay.
So we can compare where she was
Yeah.
initially, because this is today where she was front. It's loading.
That's the before.
Yeah. So she was still at red,
Okay.
9%. Not so much of an improvement because she has skin of color. So we still need more time for treatments and she needs more patience, yeah? Because we said initially, anybody who has skin of color from Fitzpatrick 4 to 6, it means at the basal layer, you produce more melanin.
Yes.
Any state of inflammation to your skin will make more pigment rise.
But like even just looking at it visibly,
Yeah, visibly there's a lot of
you can
improvement.
see there's
Yes.
a huge difference between the two pictures.
Yeah, let's look at the left side today in terms of spots. On the left side.
Yeah. 'Cause
So her skin was more inflamed.
absolutely.
And why we like using score to trace for progress.
Okay.
So let's go back and look at the first score, which is left. She was at, this is 57.
Yeah.
So right now, this is at,
20 something?
yeah. 45.
Okay. So
Yeah.
there's an improvement.
There's an improvement, but we still have a long way to go. Visibly, you can see the breakouts have really
Yes, the breakouts are
reduced.
less.
Yeah. Look at the right
Like
side.
you can see that the breakout in the sense like the spots,
Yes.
acne is way less.
Yes. So we have today, okay, and we have before. This is right side.
Oh yeah, there's a big difference there.
Yeah, and we can do a comparison of side by side.
Ooh, that's the comparison side by side.
Yeah. So this is after. This is before, and this is after. So we had to stop the state of inflammation
Yes.
by the genesis of the breakouts. So this time we are trying to manage the hyperpigmentation. This needs extreme patience, consistency, skincare routine that
To
is
get that even
tailor-made.
tone.
Yes. We do peels, we could do strengthening treatments, we could do microneedling. But what she needs to do so much at home is consistency with her skincare regimen. Yeah. Let's look at the
And for
left
someone
side.
who has acne, what is the ideal skincare regimen?
You want to combine AHAs and BHAs
Okay.
and hydration in a balanced way to control sebum production. Because ideally, acne is someone who has overproduction of sebum.
So oily skin.
Yes, oily skin, enlarged pores. You want something that is going to regulate. And also at the same time, you want to give hydration. Yeah, don't deplete so much. So I've seen clients who've come here with acne and they have believed that using salicylic acid, benzoyl peroxide is what will give them a
Like just
solution.
things that keep stripping you of your
Yes, you also need something that will replenish, lock in moisture with emollients. That is
Okay.
why sometimes you have to look at the particular client and tailor make something for them. Look at their lifestyle. She's a student, she's a TikToker. She's always on screen at night. I've given her moisturizer with SPF at night because of the screen use, excessive
Okay.
time on screen
Okay.
use. Yeah, I've also advised her it's good for you to get some good sleep, give your
Yeah.
skin time to renew itself. Anytime you sleep 4 hours, 5 hours, you're cutting your time for skin to renew and restore itself by the time you're sleeping. At least 7 hours plus
Interesting.
is good.
Okay.
Yeah. So that was left. Let's look at.
So you cleanse,
Yes.
and then you moisturize,
Yes.
and then you put serums.
In her case, she has a cleanser.
Okay.
It has benzoyl peroxide. We want to use benzoyl peroxide, which was killing the acne-causing bacteria.
Yes.
Then she had a hydrating serum
Okay.
that made sure her skin is not so depleted. There's good hydration. Then she has a moisturizer, which has SPF. And recently I've given her melanin inhibitors that are going to make sure her skin is just suppressing the melanin production on her skin. We've come out of this state. Now we are trying to control the hyperpigmentation. And you can see she still has enlarged pores.
Yeah.
She has dark circles. So it is something we're going to work on slowly. But this is good progress. So
We're happy.
yeah, we are happy.
You happy? Yeah. Thumbs up.
Yeah, sorry. We could look at the other.
Yeah. Actually, yeah, wrinkles is something that, people don't know what to do to stop the aging, especially the importance of SPF, the importance of sunscreen,
Yeah.
which is, there's always this misconception and stereotype that, oh, I don't need sunscreen because I'm a person of color, for instance, or also I'm not going out in the sun. I'm just indoors, so I don't really need to put sunscreen.
Yeah.
So these are the common myths,
Yeah.
right? So what would you like to say to someone who's watching who has never used sunscreen in their life because they think that they don't need sunscreen?
I think if you don't have any skincare routine, two products that you can add is a cleanser. You want to remove the buildup of dead skin, and you want to protect. You want to protect your skin because it doesn't matter your phototype color. Phototype is what we mentioned, your light, your dark. So you want to make sure you protect your skin from UV damage. And UV damage is UVA, which causes aging, UVB, which causes burning. And as much as we are in here, there's still rays of the lights.
Yes,
yeah?
absolutely.
Yeah. So whether you're indoor, you're outdoor, it's important to wear sunscreen. There's climate change. When it's cold, it strips off. Yeah. So you need to make sure you protect your skin. Those are the basics. So it doesn't matter your phototype color. You need SPF protection.
It doesn't matter if you're out in the sun or in the room, in the
Yes.
house.
Yes. The other thing, if you work outdoors, you need to reapply because sweating will make the sunscreen wash off.
Yeah.
So you need to have reapplication. If you're indoor, you could do, it's not practical, as they say, you reapply your SPF after 2 hours. But I would recommend if you're exposed in the sun, try as much to reapply because you're exposed in the direct sunlight.
Right.
If you're indoor, you could do one reapplication.
During the day?
Yes, around lunchtime.
Okay.
Yeah.
Noted. So that's for someone who leaves the house in the morning.
Yes.
Then by lunchtime, you make sure that you reapply.
Yes. If you're leaving the house and you're in the office, you still have a lot of screen use. Probably you're working in the office and you have a lot of screen use. You have the lights that are indoor. These still cause damage to the skin. And you cannot see the damage in one day. It accumulates over time. So one day you wake up, oh, I have melasma. Oh, I have post-inflammatory hyperpigmentation. I have solar lentigos. Yes, yes. Because you want to make sure your skin cells perform at their best so that you don't get premature aging.
Interesting.
And you can only support that with proper regime.
And what age do you think you should start, a skincare routine or applying any sort of SPF or sunscreen? So what age do you think you should start doing this?
I think in your 20s, you need to start as simple as a cleanser,
Okay.
a moisturizer, and a sunscreen.
And then in your 30s, maybe you can get into like retinol.
Yes, you amplify. And vitamin C, an underestimated skincare ingredient that's very important for using during the day. So you can incorporate a cleanser, vitamin C during the day, moisturizer, and SPF. And actually, vitamin C and sunscreen are a perfect combo for something we call antioxidant protection. The environment has so many toxins we can't see with our naked eyes.
Right.
So vitamin C will give that film of protection combined with sunscreen.
Okay.
At night, you can incorporate a hydrating serum, an exfoliant, which could be retinol, niacinamide. So depending with where you're at, because you could use stronger retinols if you are much older. Maybe you're getting into your 40s, or depending with your condition, if you have acne, hyperpigmentation, I would recommend you use retinol that is a bit like a spot treatment.
Yeah.
That is a specialty product for using at night.
And not so concentrated.
Not
Because I know there's some that says this much percent.
Yes.
This much percent.
Yes.
Yeah.
But if you have 3 conditions to target, I'd give you a concentrated
Okay.
retinoid. Yeah, if you're targeting, she's young, she's only targeting maybe, for her, she's targeting several issues: acne, hyperpigmentation, she has enlarged pores, but she's still young, she's in her 20s. So you want to give her a retinol that she could use several days a night, not every night.
Ah, okay.
Yeah.
Interesting. All right, let's get to pores.
Yeah.
No, texture and pores.
Yeah, so wrinkles, she still has a long way to go when it comes to wrinkles. So what percentile does, it compares people of her age, race, to see what is the comparison.
Right.
Yeah, but this is the older one. Let me open the new one. % still.
I mean, obviously with wrinkles, you don't really see them until now you're in your 40s.
Yes,
Even
yes,
in
yes.
your 30s, like,
Yes.
you barely see wrinkles on somebody
Yes.
with a naked eye.
Yeah.
You do a skin analysis, which is why it's so important.
Yes, it is the first step in any skin treatment. It gives you an informed decision on what you need.
Okay.
Yeah. So that is wrinkles. She's quite young, but the fact that she has textured skin, Visia will detect this is wrinkles. Yeah. And around the eye area.
That's usually the area that is the most problematic with wrinkles, right?
Yes.
The fine lines.
Yes, you get crow's feet up here. And the skin around the eyes being thinner than the rest of the face, it's quite fragile. So rubbing your eyes.
Oh, I do that so much.
Yes. It's going to cause dark circles.
It just feels so good.
Yeah, she just started on her eye cream. Yeah, I hope you've been consistent.
Yeah.
Yes. So we just started her off with an eye cream, and we've advised her to just dab without pulling.
The ring finger, right?
Yes, the ring finger. So texture.
Yeah.
We all have dead skin. This is good. It's 54.
Okay.
Yeah. She started on retinol, which is helping to accelerate cell turnover.
This is a big improvement.
Yes, this is a big improvement, and it removes dead skin. She doesn't use her retinol every day because aging is not the issue.
Yes, it's not.
It's hyperpigmentation, it's enlarged pores, and it's acne. Retinol is a gold standard ingredient that can resolve several conditions in one. That's why we give her. So as I was saying, everybody has dead skin. That is why it is important to exfoliate. Yeah. Pores. Of course, pores will tell us her skin condition. 10%. You can see she has pores. The blue. You can see the blue circular.
Yes.
Yeah. You really cannot say you're going to finish pores, but you could manage them to be smaller.
Yeah.
Or
Tighten them.
finer.
Finer.
Yeah. A natural method is icing. Icing put on the skin after cleansing helps to constrict the blood vessels.
Okay.
So it improves the lymphatic drainage of the skin.
Every day? You can do that every day?
Yeah, morning and evening.
Wow.
Yeah. Don't put it for so long so that it doesn't cause an ice burn.
Okay. So
But
how many minutes?
By the time the ice cube is running out, it should be a minute. Yeah.
That's all.
Yes, massaging it on your face. Yeah.
Interesting.
It also soothes inflammation for someone who is acne prone like Marlene. So when it comes to pores, there are treatments that we recommend to help manage them.
Yeah.
There are skincare ingredients. Exfoliating is one of them. AHAs and BHAs in terms of skincare ingredients. So we really customize that based on you so that we do not overstrip your skin by giving you so many exfoliants. Yeah.
Noted.
Yeah. UV spots. She's doing great when it comes to UV. You know why? She is Fitzpatrick 5'6".
Ah, yes. Which means
So
that
there's
she
no
has-
detection of sun damage.
Okay.
The damage you're seeing here of the hyperpigmentation is superficial.
Right.
It hasn't gotten to the deeper layers of the skin.
Okay.
When you look at her physically, yes, you can see some areas are darker than others. But when pigmentation goes deep, it could cause melasma. She doesn't have that. So what is giving her good results here? It's her phototype.
Okay.
If we had phototype 1, you'd see clearly the sun damage. Brown spots. So the brown spots are what have caused the post-inflammatory hyperpigmentation. You can see the flickers.
Yes.
Yes, these are the areas that have gotten the inflammation from the acne that she's been struggling with. So this is at 61%, not so bad. We still have improvement that we can achieve.
Yeah.
You can see she's above 50%, it's green. If it was below, it would be red.
Okay.
Yeah. So we've already noticed the areas that are alarming, the spots, which we could clearly see. Wrinkles and pores.
Yes.
Sensitivity of the skin, which is the red areas. What causes sensitivity? Excess sun exposure.
The sun exposure.
Yeah, what causes sensitivity to the skin? Excessive sun exposure, using exfoliants that strip off the skin.
Like scrubs.
Yes, yes, physical scrubs.
Yes.
Now we have chemical exfoliants that you really have to put a product on your skin and it's going to do the job. You don't have to use those physical exfoliants, yeah?
The ones where you keep scrubbing and
Yes,
then it
yes.
just strips off all the
Yes, yes.
moisture.
So with technology in skincare right now, we have chemical exfoliants which do a pretty good job.
Okay.
Yeah, so the only sensitive area detected here is here. And if you put your finger here and go to spots, you can see there's a little inflammation.
Yes.
Yeah. So before acne forms, it could take about 90 days.
Oh, okay.
Yeah, so this tells you there's inflammation going on. The best thing she could do, she shouldn't poke that area. It's going to cause more inflammation.
That's the worst thing that you can do for your skin,
Yes,
right? Picking
yes.
your blackheads,
Picking your blackheads.
pimples
Yes.
to remove the pus.
Yes.
And that causes scarring.
It causes scarring. It passes on bacteria onto that area that you're trying to work on. So she
Yeah.
could ice the area. She could use a spot treatment with benzoyl peroxide.
But never poke.
Never poke. Yeah. So we've already given her that education since
Yeah.
she's been our client.
I mean, also for you, if you're watching, honestly speaking, because I feel like I did that a lot when I was in my teenage years.
Yeah.
And I still have some scars because
Yeah.
of that.
Yeah.
Only to realize that instead of making my skin better,
It got worse.
It got worse because then more and more acne started
Yeah.
coming and I had more breakouts.
Yeah.
So it's really bad for you.
It's bad for you to pick, and I'll tell you a treatment that takes time.
Mm-hmm.
Post-inflammatory hyperpigmentation. You can see with Marlene, we've been here for about 5 months.
Yeah.
We're still working on the inflammation.
Absolutely.
So that's the first thing we tell you. Don't poke. You need to be patient.
Yes.
She used to use sugar and honey scrub.
Which is like DIY scrubs
Yes.
at home.
Yes, which is more of a physical scrub
Yeah.
that caused more inflammation. So we have to be gentle. Yeah, she's come a long way.
Yeah.
Porphyrins. Basically, bacteria underneath the skin.
Okay.
Earlier, we saw her pores.
Yeah.
For a pore, there's sebum underneath that is trying to get onto the surface of the skin.
Right.
So when this sebum is stuck up here, it is bacteria. And we are trying, we all have sebum and sweat. Here is the sweat. It needs to rise to the surface in a balanced way to produce something we call an acid mantle,
Okay.
which basically is that glowy. Have you seen people with oily skin and they don't use moisturizers?
Yes, I have.
It is because they have a balance of sebum and sweat that comes onto the surface of the skin, and it acts like a natural moisturizer. But when there's an imbalance, so she has more sebum and less sweat, that's why she gets the breakouts. So the pore doesn't have a way of releasing the sebum onto the skin. It has to force its way out. So in that process, that is bacteria underneath.
It's trapped.
So it's trapped in the pore. That is why I mentioned earlier, she needs something hydrating so that the trapped bacteria has a nice way to glide
Seep
onto
out.
to the skin.
Okay.
Yeah, you understand? So an ingredient like benzoyl peroxide is good for removing the salicylic is going to help, benzoyl peroxide, but you want to be careful not to overstrip.
Yeah.
Yeah.
And this also happens like with women who use a lot of makeup and
Yes.
makeup products,
Yes.
and then they just get trapped inside because you're not.
They clog
cleaning.
the pores.
They clog the pores.
Yeah.
And when your pores get clogged, eventually you start getting acne.
Yeah.
So for someone who uses very heavy makeup
Every day.
every day, for instance, what
They
would you
need
tell them?
to They need to remove their makeup carefully in the evening. They need to double cleanse.
Not just wipes.
Not just wipes.
Yeah.
Wipes have alcohol.
And not just makeup remover. You have to wash it, right?
Yes, you have to wash it off. If you're using a makeup remover, you could use micellar water, which tends to be quite gentle to the skin. Double cleanse your skin. Ensure you're using a very clean white cloth so that you could see the residue of the makeup around hidden spots like hairline, around the eye area, behind the ears. And if you use it every day, you also need to incorporate monthly treatments that are going to help you have the makeup.
Like facials?
Yes, facials, yes.
Okay.
Yeah.
Yeah. So ladies, if you use a lot of makeup, remember you also have to make sure you take preventative measures to counter that, which includes cleansing your face, monthly treatments, so that you manage your skin well.
Yes.
Yeah. So far,
this is an
good.
Overview. Yeah.
How's the progress in these past 5-6 months?
What I would say as a final statement with our client here, she's been very eager to follow instructions when it comes to home care. She really keeps time with her treatments and she asks questions when she's not sure. I would say skin health is a progressive treatment where we work together and you have to be consistent and you have to show up and you have to have a positive attitude.
Yeah.
People who struggle with acne or any problematic skin condition will have things like very low self-esteem.
Very impatient as well.
Yeah, very impatient. And I am always honest on the first day, you need to be patient. Your skin, from where we started to where we're going, you need patience, you need to commit, you need to follow instructions at home, you need to eat well, sleep right, and a positive attitude.
So let me stop you there.
Yeah.
When you say eat well, what do you remove from your diet or what do you add onto your diet to make sure that it's balanced so that your skin can also thrive?
We've had instances where clients come and the first 6 months, we don't know what causes this breakout. It could be hormonal, it could be diet, it could be lifestyle based. So we'll ask you, how do you eat? Do you eat lots of carbohydrates? How much milk do you take?
Sugar.
Are you a coffee person, sugar person? So sometimes we are not the nutritionist, but we'll tell you plus minus this.
Yeah.
What do you think is a trigger?
What are you overdoing?
Yes. And we've had clients who've come and they find out, oh, I take lots of sugar. I do lots of coffee because coffee dehydrates skin. I do lots of milk. Anytime I stop milk, my skin thrives. So when we walk the journey, we also get to find out the triggers. For Marlene, in this case, it was more of hormonal.
Yeah.
Yeah.
Which, by the way, I think is majority of the women who suffer from acne.
Yes.
I think it's hormonal acne.
Yeah.
Most of the
Which
women.
is something we can't control from the internal part because it's the endocrine system.
Yeah.
She could try and balance things like stress, because stress is going to trigger some hormones that are going to produce excessive cortisol levels and stress, and she's going to get overproduction of sebum. Yeah, so when it comes to acne, well, it's the hormones that trigger excessive sebum production. There are instances where we have to refer the client to go for a hormonal check.
Yeah.
Yes, that they could have the professional balance their hormones. And something I would also say as a final statement, a client should not take advice from so many people. When you struggle with skin, yes, someone tells you use turmeric, use this.
Yeah.
Seek advice from one person. Go to one medical spa or one skin clinic and walk the journey with them and be patient. You're going to get the results that you want.
Yeah, which we've seen. So
yeah,
I'm happy for her. Like I feel like your skin is doing really well. So well done, well done. And I feel like there's a lot of progress that has happened over the past, and there's still a long way to go. But then again, as you've said, Milka, patience is everything.
Yeah.
So just be patient and just follow the instructions of one person.
Yeah.
And now I'm seeing how amazing this skin analysis is. I feel like I also want to do one. So maybe we could also do one on my skin.
Sure, we can.
I've never done one, so I have no idea what's going on in there.
It's good for you to know. Yeah.
Like when you see me, you probably think that I've got good skin, but I've also struggled. I had acne-prone skin when I was in my teenage years. In fact, up until my early 20s, I still had acne. And then in my mid-20s, it cleared. So now is when I finally managed to figure out like my skin, my hormones. I also had hormonal acne. So my journey is very similar to hers. So I also would like to see what's happening. So we'll maybe do that in a moment.
Yeah, let's get it done.
Absolutely.
Yeah. You have pores, you have the depressed scarring from previous breakouts.
Yeah.
These are spots. Not bad. 77%. Yeah. With a few melanin inhibitors,
Okay.
you'd be good to go.
Okay.
Yeah, this is where my worry actually was initially. When I thought of you, Fitzpatrick, but not bad. You see where they have the yellows?
Yeah.
That's sun damage.
Oh.
Notice the small spots?
Yeah.
This is how melasma starts.
Really?
It starts this way, it builds up in terms of size.
Okay.
Melanin inhibitors is something you need. You still need to suppress because you burn easily.
Yeah.
So you pigment easily.
Noted.
Still 92% with a score of 8 is not bad. Sensitivity, not bad as well. So for lighter skin tones, you can actually see the blood vessels. See? If you do several enzymes, this will go down.
Okay.
Because it will improve circulation.
Yeah.
Offerings, you are worried, not bad. Your skin actually, it has been drying out.
Dry? Well, I thought my skin is oily.
Your skin is oily. Depending on what state you put your skin on, it could deplete. Remember when we were talking about people using lots of acids, AHAs, BHAs, they could strip. So we need to relook at your skincare routine and at the ingredients.
Okay.
Because you don't have bacteria, but this aspect or this element helps me to understand someone's skin type.
So why is it only my nose that's the most, like it has the most bacteria?
Because you see the area around the nose has more density than the rest of the face. Your skin is tending to dry on the edges of the face. Skin type changes depending with the skin condition. Yeah. So you're born oily, you had acne, as you age, you're gonna start drying.
Oh,
when we get into our 40s, yes.
Okay.
That is why hydration for everybody is very important.
Okay.
Pores are enlarged,
yes.
Which tells you this is what you were struggling with when you were younger.
Yes.
Sebum production.
Yes.
But the same pores don't have sebum because we would have detected on the porphyry.
So it's just I need to do maybe microneedling.
Yes, microneedling will do so much.
Okay.
Spots, they are also not bad. And notice lighter skin tones, your spots are not visible. But if it was marine, a little small inflammation is making the whole area more darker. Yeah. And eye cream is necessary for you.
Imagine I don't use eye cream. I need to start using eye cream.
Eye cream for the, because the hair, this is a bit deeper, that green is deeper.
Is that hair?
Yeah. And it's the same. See there? Than this.
Yeah.
So color blue are the depressions,
Okay.
the yellows are the raised. And this is the texture we were talking about when we were talking about microneedling.
The microneedling helps
Because your skin is
texture.
not even.
Okay.
Left. So your most problematic areas are
Cheeks.
around the cheeks.
Yeah, that's where I
Just
had.
a little.
That's why I had acne.
Which was hormonal.
Yeah, hormonal acne.
Spots, not bad. You can see the spots when you click up. Still there. So this builds over time and it gets darker over time.
Oh, really?
That is why it's starting to become more visible under the brown spots. See how this is clear? Switch off the lights, it's more clear.
Yeah.
It's even showing your facial hair. So, true skin is what everybody dreads.
Damn! Gen Z! It's showing me as a 23-year-old.
The elements of your skin and what's why your score is good, your internal elements of your skin are good. The internal is UV, brown spots, red areas.
Okay.
The only area with concern is the
Under eye?
pores and texture.
Okay.
And we could see visibly you have enlarged pores, you have texture issues because of the previous acne that you had.
Yeah. So I just need to use eye cream, as you said,
Yeah.
and I need to do microneedling.
You need to do microneedling with very good concentrate serums.
And what do you say, melasma inhibitors?
Melanin.
Melanin inhibitors.
Yes. This
For
is the
spots.
sun damage starting to build up. You can see on your skin it's so visible rather than myelin skin.
But do you know, it's crazy because I use a lot of sunscreen.
That is sunscreen. We need to check whether it's mineral, physical.
Oh.
There's so much when it comes to ingredients. There's sunscreen that when the sun rays hit your skin, they reflect back immediately.
Okay.
There's sunscreen that they penetrate onto your skin slightly, causing thermal energy. During that process of energy, you can get pigment.
Oh.
And you could only know this if I look at the sunscreen, I check whether it has zinc oxide, titanium oxide, or some other ingredients. Okay, but your skincare has those very hard ingredients to understand. If it's not zinc or titanium, you're having the physical.
Interesting.
You need a mineral, it's the best.
Okay.
And that is what people hate because it causes, they say it causes white cast, or they look like they have white cast.
Oh yeah.
You
I
just
don't
need,
like white cast.
but you just need proper application.
Okay. So overall, not bad.
Overall, not bad. This is something you could come and check later when you do 2 or 3 microneedlings.
Yeah. The pores.
Yes.
And the texture.
And this just needs a few microneedlings, a few pills.
Okay.
Actually, with 2 treatments, you'd see a lot of change.
Mhm.
Yeah. But good concentrates. Yeah.
Okay.
Even here,
Alright.
you had acne.
Yeah, I did. My whole face, literally everywhere. Yeah, I'm shocked that my forehead is not bad because even my forehead was full at a point. But I think I
Forehead
did.
is not bad.
But I think I did poke. I used to poke my cheeks a lot. Yeah, I hated acne. But yes, overall, it's a thumbs up from Milka. Milka, tell them my skin is a 23-year-old Gen Z for life. Life is not perfect, but your skin can be. And that's what we've learned today at Milka Wamboy's Skin Clinic. It's called Skin Reveal Aesthetics. And there's so many different things that I had absolutely no clue about. I've got to learn a lot about my skin as well. And I'm sure you feel the same. So thank you so much for watching. I'm glad that we could teach you a thing or two right here on TV47, The Morning Cafe. We'll do it again next week.